Wellspring, and I want to introduce you to the body cushion and the massage table that we're going to be using today during the Wellspring massage. The body cushion is actually an orthopedic positioner. It's very useful in supporting the bony structure of the body up off the table. We have a foot bolster, and these pieces are all adjustable depending upon the size of your client. So you can move it up and down. This part has a chest support and a pelvic support. You have a breathe hole here. I can use this for people who have extremely large bodies as well as pregnant women. With a pregnant torso, you can actually add adjusters. If someone has, let's say for instance, a lordotic curve, you can add another dimension. It gives it a nice flat back. Also on the body cushion, we're supporting it by a golden ratio table. The table has a wonderful headrest on it. I choose to use the headrest on top of the body table as well. And then when we're done, we can turn the person over, which you'll be seeing later. And then we can remove the body headrest, and we have total access to the chest and the neck. And as well with this hole here we have for the stomach, when they're lying on their stomach, when they're on their back, we can get in and work the paraspinals. It's very effective therapy. You can ask me later about how to get these products. It's a wonderful support for pregnant women. It's difficult to lay on your stomach when you're pregnant, and so I highly recommend them. So we'll be starting the massage next. Okay, we're going to start the massage with some gentle rocking on the spine. We're going to relax the person that we have on the table, and you'll notice that when you're positioning your client on the body cushion, you want their knees to come out just a little bit. So they're going to externally rotate their knee, and this opens up the hip. So we can relax the spine, a little gentle rocking along the spinous processes. And we want to encourage this body to relax into the table with a little spinal twist. Just a little pressure. One hand starts on the sacrum and on the opposite side on the shoulder blade. And as you apply pressure down, you'll see a gentle stretch in that spine. We're going to come all the way down. How's that feel, Ellie? Good. Okay. Now we also want the person to be very relaxed. This is a passive massage. The Wellspring massage is based on the spiritual connection between the body and the mind. And as we work with the subconscious mind, we want to be real gentle so we can convince the subconscious to let go and to agree with us on this letting go process. You want your person to relax and breathe. And each time they breathe, their body begins to take a different shape. So instead of gravity holding us up and we're more rounded, then as we begin to breathe, we become more oblique, and the deep muscles of the spine can relax. And this is going to help further the deeper part of the relaxation. Now to begin with, we're going to uncover just the area that we're working with. And with the back of the leg, which we're going to start with now, we're going to uncover all the way up to the low back because we want to include all of these muscles. The low back muscles are actually attached to the lower leg, and with these rotator muscles, we want to be able to affect them because they're all fed into the same body part. So we're going to move the sheet over, and we're going to secure it nice underneath the opposite leg. That gives our client total privacy, but not too much exposure so they don't get cold. And it's real important to try to stay as close in contact with your client as possible so that they don't lose that sense of touch that keeps them feeling secure. Always warm the oil up in your hands before you begin. With gentle strokes, we're going to apply the oil all the way up to the low back. And massage has also been called a dance because you move so much around the table. You want it to be a flowing movement. Some massage therapists like to practice Tai Chi, and some practice Tao movements or yoga, anything that's going to help you as a therapist. Body weight is real important. So on these beginning strokes, right now we're just applying the oil, but you can see I'm contacting most of the body with the flat part of my hand as I begin to spread the oil using real light strokes, but they're comfortable strokes. A little bit of movement just to begin the spread of energy. Anytime you move body parts, you bring those energy meridians up to the surface so that you can work with them. So we're going to be concentrating on muscles and joints, but the underlying benefit here is the energy meridians and the energy that we're going to be imparting on our person. Little vibrations. Okay, now we've got a nice good layer of oil. Just want to make sure into the low back and all the way down so this whole body part feels real connected. We're going to start on the foot. Reflexology is so important. All of the energy meridians as well as all the nerve endings end in the foot. So we want to start working on the feet to affect the whole body. And the foot looks like the body if you were standing on your face. You have sinus points on your toes, lung points on your arch. The small intestine is in the middle, your colon, and your low spine here. All around your ankle is your low back. So if you're having low back problems, you can work on the low back on your foot. You always want to go up towards the heart, and on the foot we're going to go up towards the toes. And be sure and come off the toes, otherwise they'll feel congested, and that won't be very nice. And you want to cover every surface. All those little joints really enjoy being touched. Now we're going to work up the leg and spend as much time as you want to on the foot. Don't rush. The first stroke we're going to use is called an effleurage. It means to flow in French. You begin along the midline of the leg and come around in a circle. And you go up and complete another circle. So there's an overlap in the effleurage stroke. When you go up to the popliteal, which is the back of the knee, you want to be real careful. A little bit of pressure is okay, but not too much. Now, because we have her knee bent, we're not stretching those nerves, arteries, and veins behind the knee, so it's okay to have a little bit more pressure. We're going to take this all the way up the thigh, and when we come to the low back, we're going to do what I call a figure 8. One hand goes up into the small of the spine and the other one comes out in the sciatic groove. And then you switch hands. So you get a nice separation in that low back. This is simply to suggest to those quadratus lumborum and paraspinals that they can begin to relax. But we're going to connect it now, going down the leg. A little bit more body weight. Each time we go through this pass, we're going to go deeper. And now, petrissage. Petrissage is a squeezing, kneading kind of stroke. We're going to go up the gastrocnemius and down it. Real gentle. We don't want to go too deep too fast. If we do that, we may end up with a startle reflex, and we don't want that. We want to go real gentle. Little vibration. The therapist needs to breathe just as much as the client breathes, so that at the beginning of a stroke, you take a deep breath and then you begin the stroke as you exhale. When your client is receiving, they need to exhale just as much because we're releasing toxins. We want those muscles to relax. So when you take a breath in, your muscles begin to contract and your spine expands, your rib cage opens up, lets the air in, and then as you relax, simply let the weight of your body express the air out, and then you can get a deeper relaxation. It also enlists the brain to begin to release endorphins, which is going to help with the deeper relaxation and lymphatic drainage that we're going to be creating. So I'm going to work a little bit on the ankle. This feels really good to the client. This is a very delicate area with lots of tendons and fibers and a lot of energy going in and out of this ankle. This feels really good for the client. Now we're going to rest ourselves on the table and just simply rest the client's foot on your chest. And with the side of your hands, you're going to come down from the ankle all the way down the gastrocnemius, and let me know if I go too deep, okay? Good. Always get feedback from your client. And come all the way back up. We call this the elevator technique. And so you go down, and notice we're going towards the heart. When you get to the popliteal area, come around and come up the sides of the leg. And always include the foot. It always makes it feel real connected that way. Now to work the back of the leg, we're going to slightly rotate her leg and come up the inner hamstring muscle with a real gentle stroke. Stopping at the TBI, which is the sit bone, coming back up, and then internally rotate the leg, coming up the outer hamstring muscle. And here it's a little bit more easy to go ahead into the low back, coming back out again. Gentle stretch. Just breathe with this. Is that good? Far enough? Okay. Just take it to your client's comfort level. But if you work the back of the leg first, then you have a reciprocal nerve innervation for the front, which will relax the quadricep muscle, and then they can relax with that. They will release it. But we want to do a little bit more deeper work on the thigh, so we're going to do what we call a crossover stroke. We're going to come down. You're going to start with the inner and outer thigh at the same time. As you press against your hands, keep them flat. You can also support your elbow on your hip to give you more leverage. And you're going to twist your body at the same time as you push and pull. Very, very gently. And whenever you get done, you just gently come up, go to the other side. Now, the crossover stroke can be done on many areas. The back of the legs and the back of the torso are two of my favorite for large body parts. Just make sure you keep your hands flat because you're not doing deep work. You want to spread those muscles, relax them. And you work all the way up as far as possible. And then smooth it out. So you notice there's a lot of overlap when there has a stroke, you also have a return stroke. The return strokes are usually much lighter than your beginning stroke. And you also want to connect each of the areas that you're working on. I'm holding the point, this is a little polarity therapy, to connect the body parts because we're going to go work up to the hip, but we've ended at the foot. So in order to get a nice smooth transition, then we go from the low back on the foot and the low back on the back. And just hold these points for a few minutes and let energy do its cycle, so that when I leave and come up here, I have a nice smooth transition. So we're going to start on the gluteal area. Now we're going to work from the sacrum to the greater trochanter. And in this area we have a lot of muscles, nerves, arteries, and veins. The largest vein, the largest nerve in the body is the sciatic. So this is an excellent area to work on for people that have low back pains, on a pregnant woman especially, cramps, people that have been sitting for long periods of time, driving a car, truckers, computer people. Do the figure 8 on the low back, and then this is called a hand over hand. Large part of the palm, hand over hand in the sciatic area. And each of these strokes are going to go deeper and deeper, and as they do, I can go to smaller and smaller body parts. Smaller and smaller parts of the hand. So the fingertips would be used for very small areas like the toes, and the palms would be used for larger body areas like the back and the thigh. And if you keep your fingertips together, they feel like one huge surface. So now we're going to go to fingertips, and notice I'm going away from the heart, but here this is a particularly special area because we want to go away from the low back to include separation in the lumbar spine. So now I'm going to go to thumb over thumb, and I'm going to start on the trochanter, just above it on the iliac. The muscle I'm working on over here will help relieve low back pain that causes the feet to go out because of extreme low back tightness. And it will begin separating the gluteals from the sacral spine. As you go slowly, one thumb follows the other, so the muscles begin to stretch. And you can keep them going in that stretched position by following like a wave, one thumb after the other. Notice I'm working from outside to inside. So we go from the lateral side of the hip bone, coming medially all along the sacral border. Very good. A little tightness down in here. See that? Little ligamentous tightness in here. So we're going to hold, apply a little pressure where we find these tight areas. A little vibration, help it let go. And then smooth it out again. Hand over hand will help smooth things out again, and we can begin a little bit deeper work. I'm going to knead her gluteal a little bit. Bring some more blood supply in here. Now we're going to do just a static hold. I'm going to go very deep, very slow along the sciatic groove, right where that sciatic nerve goes. And she's going to breathe as as I go through, very slow. And muscles will twitch when you're doing this. It's a very voluntary thing, involuntary I should say, simply because muscle contraction is a chemical process and we accumulate acetylcholine, which is our neurotransmitter for muscle contraction. And as we begin to work deeply into these muscles that are tired or overworked, then what we're doing is we're forcing the acetylcholine to bind with the receptors on the postsynaptic portion of the nerve, and it causes a firing and the nerve contracts. And it's nothing that they're doing, it's just simply a process that happens. So, smooth it out again. Do a little figure 8 on the back. We want to reconnect the whole body now because we stay too long in one area and we don't want the rest of the body to feel neglected. So we'll come down with a Y stroke, little body weight, all the way down to the ankle and the foot. And we're going to go back the way we came and begin with some light strokes on the leg. Coming out lighter and lighter with each stroke, a little vibration, just like we started with. As we cover the leg up, we don't want to let go. We want to keep that touch. And feather stroke off the leg we just worked on. This leg is going to feel a lot lighter than the other leg. And we'll give the body a chance to check in with itself and send the same nerve vibrations over to the other side. So we can encourage that with some other light stroking on the opposite leg before we begin that leg. Okay, so we're not going to do this leg. We're going to let you do that on your own. But you have the whole routine for the lower leg. And next we'll go to the back. And I wanted to bring up the concepts of stress and how this impacts our lives and why the massage works so well in this way. The massage is done very, very slowly because we're working with the subconscious mind. And that part of our brain is housed in the thalamic area in the limbic system. It's also an area that is associated with the responses that our body has to stress. So the idea was brought up that if stress can cause so many problems in our body, then the opposite should be true if relaxation is employed. And that's exactly true. And the area of study that really focuses on that is called psychoneuroimmunology. And the whole idea is that we can think ourselves into a state of illness or dis-ease, just as we can think ourselves into a state of wellness or well-being. So it's not really the stress that bothers our bodies that much. I believe we are designed to handle stress. I believe it's more how we handle the stress that makes a big difference. So by employing the limbic system, which we have total disposal at our hands, or at our minds actually, we can get the hypothalamus and the pituitary to begin to work with us on a much more deeper cellular level as we begin to think more positive thoughts and to do more positive things. Less stress bothers us. A muscle responds with stress. If a muscle is not used, it atrophies. If a muscle is not used, the bones will become brittle. as in an older person, the marrow becomes yellow, so the core begins to just disintegrate, and we don't make blood cells, and all these things that are important for movement and function. So as we add resistance, which is like a stress, to the muscle, we're building the bone fiber. We're creating much more strong cords of tension in the bone and building muscle fiber. Now, muscle weighs a little more than fat, doesn't look as big though. So the more you move your body, the more you're stimulating the thalamus to do its job, which is to work with the antagonist-agonist idea of when one muscle contracts, the other one has to relax. It's also working with the idea that when you stimulate the thalamus's job is to reduce pain in the low back and to elicit portions of the limbic system, which is in the reticular fibers of our brain. And it is also my belief that that is where our subconscious mind is housed. So it's not unusual when you're relaxing for emotions to come up to be healed, tension begins to let go. You might even experience pictures of past experiences coming up, which is just fine, but you don't have to do anything about it. You just simply relax, notice it, and then breathe and let it go. So remember that the psychology of your health is real important, just as important as what you put in your body and your food and your nourishment. You want to nourish your spiritual body with positive thinking and relaxation to counterbalance the stress that you're going to go through on a normal day-to-day life. So with that in mind, we're going to finish this segment of the massage, the Wellspring Massage, and hope you join us next time. In this segment, we're going to do the upper torso. We're going to include the upper hips, all the paraspinal muscles, some of the arms, and the neck. We're also going to do a little bit of energy work at the end to balance everything before we flip and do the next side. So we're going to real gently lower the sheet to a comfortable level so that we can get the whole spine and sacrum exposed. Her arms are to the side of the body cushion, nice and relaxed. This will help open up the spine and the area between the scapulas. It's real important. So again, we're going to warm the oil up in our hands, and I'm going to use a little bit of extra lotion because I want to moisturize her back. So we're going to warm the oil and begin with light strokes. I'm sorry if it's too cold. Include the arms, and the hands, and the neck. Now this is a gentle, real light stroke that I'm using to just begin application of the oil. So it's a combination of the Y stroke and the effleurage. And we're going to include the whole back, both sides, while we're doing the warm-up. And as we begin to get more specific, we'll go to one side of the spine. And we're going to effleurage the hips. And as we do so, we can begin relaxing even further those paraspinal muscles around the hip and the area that we've already worked on. So here we have already a connection between the work that we did on the lower legs and the next section that we're going to work on, the upper back. So let's go over this stroke. This is called the master stroke. You start at the shoulders. You go through the shoulders, down along the spine, staying real close together. Your hands are touching. You go along the lumbar spine, stay off of the spinous processes. Include the hips, come up, around the shoulder blades, down the arms. When you get to the hands, you can actually grab and tug a little bit, and then light return stroke up to the neck, including the neck, and then repeat. The master stroke can be done many times. You can do it several times at the beginning of the massage. You start out light and go a little bit deeper each time. You can go down to the sacrum, or you can also stop at the waistline. So I'll show you a few variations. You come off the hip, down along those quadratus, then include the hip, and come back up. So we've worked on the lats, the rhomboids, and the traps, as well as the low spine, the quadratus lumborum and the paraspinals. So we've got the oil nicely lubricated, and we're going to start on the shoulders. This is a hand over hand technique. You go down away from the spine, over the shoulder, and back up the neck. Then you follow it immediately with another stroke. This is great for relaxing post-cervical muscles and the upper trapezius, as well as the middle trapezius. A lot of times people will come to you with a terrible tightness in the shoulders, and this really helps to begin relaxing those muscles so that their shoulders can start to drop down into a more normal position. Okay, now that you've got that warmed up a little bit, let's do a little bit deeper stroke. We're going to start with our knuckles on either side of the T1, coming out over the trapezius, just on top of the spine of the scapula, coming down a little bit more. And before we get off the trapezius, now we're going to come up to the T1 area. Thumbs are together, pointing down towards the sacrum. And we're going to rake these muscles all the way down to the low back, just on either side of the spinous process, what I call the spinal groove. And then turn your hands over and include the hips, and finish with the remainder of the master stroke. Now we're going to work on a shoulder. We're going to work on one shoulder at a time. So this is sort of an effleurage for the shoulder. You come over the shoulder blade, you come up underneath the shoulder blade with one hand and over the trapezius with another, and you follow through. So we're tracing the scapula as we come back around. This is a great stroke because it helps you with all of the teres minor, a little bit of the posterior deltoid, coming around working on the trapezius and the lats. You can actually get in here and work on the serratus, which surrounds the ribs. And up here at the top, when you pick up the shoulder blade, you can actually get to the rhomboids as they attach to the shoulder blade. We want to get a separation between the ribs and the shoulder. There we go. So I'm going to pop out that scapula a little bit. We're going to hold this. This is a real gentle stroke. We don't want to press too hard, just hold it. I'm actually more using body weight to push the scapula out. And I want to trace those rhomboids up to the spine of the scapula and gently let go. That's good. Now we're going to start warming up the side of the spine, and we're going to use what we call a raking. Your hands are kind of together, a little bit separated. We're going to rake over the trapezius, and we're going to come down using our fingertips just on the side of the spine. You want to touch the spine, but not right on it, but right in that spinal groove. So we're just to the side of the spinous processes as we nicely do a hand-over-hand wave-like effect. And you can see how the muscles begin to pull away from the spine. This is a real gentle stretch for those very tiny multifidi and rotators along the spine. When we come to the sacrum, now this is sort of a crossover. This is a half of crossover, and I call it a hand over hand as well, push-pull. We're going to use the palm of our hand, we're going to push away from the spine, and then come back and pull. And use our body weight to help rotate the spine just a little bit. Relax those muscles. And also to bring energy to those nerve endings that come out through the ribs. This is a real good way for you to feel the tension in the body and to begin working on relaxing those muscles, suggesting to them that they relax. There's a lot more relaxation up here than there was previously. That's good. So I'm just going to go ahead and do another master stroke before we go to the other shoulder. And we would do the same thing then to the other shoulder, beginning at the neck and coming over the shoulder blade and then raking down the spine. Always include the neck on your return stroke because the neck needs so much attention. Okay, I'm going to show you the arm work on this side so that you can see it a little bit better. Now there's no oil on the front of the arm, so the first thing for us to do is to prepare that area with a little oil as we begin to gently move the arm. Now notice I've got the hand and the elbow secured so that there's no chance of injury. And we're going to come up underneath, catch the pectoral muscle. If we didn't have oil, we would have a pinching. We don't want to do that. We're going to bring this arm out in front of the table and just let it hang right there. Now we've got just a natural stretch. It's an automatic stretch for the rhomboids. And we're going to come in here and locate the rhomboids with our thumbs. This is an excellent way to work on the rhomboids when someone can't do what we call the back rub sign, putting their hand behind their back. And I'll show you that one shortly. But I like to work this one first because it helps to lengthen the muscle in an already lengthened position. We're going to also include teres minor and major as we work along the back of the scapula. We're going to start just at the spine of the scapula, which is about right there, and we're going to do lines of energy going from the medial edge of the scapula on out to the shoulder itself. And then when we come to the the axillary. This is the underarm side of the shoulder blade. We're going to come up underneath the shoulder blade and include that latissimus. We're going to do a few of those. Always include the rest of the spine, the area that you're working on. Relax, relax, relax. Is that okay? A little bit of a stretch. Okay.
Not quite as much straight overhead. I get a catch in the shoulder.
Okay. So if your client can, this is a good time to do an overhead stretch and pull the arms straight out. We're going to have to work with this client for a little while. She's just begun her therapy. Okay, relax. Just let this go limp. There you go. Now this is just a little bit of rotation, a little bit of mobilization to get some blood in that area. Yeah, there's a little catch just at the top there. Okay. So now that we've done a good general massage, this is a great general massage for the back and the arms and somewhat on the shoulder. We're going to do a little bit deeper work now. And we're going to move to this same side. And we're going to start warming it up with an effleurage. But you notice this effleurage is only one side, so we're going to do a circle going in the same direction up towards the heart, and we're going to include the neck. So you take your thumb along the spine and come up into the neck. It's a nice stroke. And then off the arm. Now what we're going to do now is fairly deep work. We're going to use our elbow and go along the spine. And if you need to guide yourself, you can use your fingers to guide yourself. But you're going to use the elbow right along that spinal groove. And just lean into it and really relax though. You can use your hands to stimulate. Because as we move our hand, we're also moving the elbow, causing a little bit of vibration. So keep your back flat, your hand relaxed, and pay attention to the tension that you find. We don't want to go too deep too fast. So this is our first pass. We're going to just look and see where that tension is. Come off over the shoulder, pushing down on the trapezius. This is another great way to suggest to the trapezius to lengthen. And as we move our forearm over the back and down to the hip, we can add a little bit extra press into the sciatic groove, just a little bit, and begin to lengthen the low back. A little tight down there. Okay, let's do that one pass again. This time they're a little bit more relaxed. They know what they're getting into. And they can relax with you a little bit more as they trust you more. It may take 4 or 5 sessions to really get that trust developed so that there's total relaxation. You have to learn how to breathe with a massage. That's a real important step. Learning how to breathe, learning how to relax. Coming back again. Okay. All right, now this next pass, we're going to come out to the lateral aspect of the paraspinals. And here we're getting the quadratus lumborum and the iliocostals. And we're also getting some energy to those nerve endings along the rib cage. But you have to be careful because the ribs have very little muscle on them, really. And as we get up to the scapula, we're going to come up over those rhomboids right next to the medial aspect of the scapula and come over the teres minor just on the back of the scapula and off of the arm. Okay. Now this shoulder is much lower, much more relaxed than the other side, and it's a very visible thing. So in order to balance her out, we will want to make sure to do the other side in much the same direction. Now these strokes can be interchanged, changed up. You can put one in front of another. You can always do the master stroke in between to kind of warm things up and reconnect. But be creative, and the only thing that I would suggest is that you do the same thing, however, when you go from side to side, so that there's a semblance of balance to the routine. Okay. So we're going to do a little bit of work on the head before we finish, just right on those suboccipitals. And in the hairline itself, just to make sure that the whole body feels complete on this side before we turn them over. And some nice gentle feathering. Now to finish this whole side now, we're going to complete with some nice feather strokes going all the way down to the feet. Come back to the hands, up to the shoulders, going back down to the feet again. And this actually works as an aura cleanser as well, for those of you who understand auras and energy. And a little bit of rocking, because we've had her lying down for quite some time and we want to get some blood and movement back into those soft joints, get some fluid back in there. Okay, now as she turns over, we can either leave the room and let her turn over, or we can help her by holding the sheet as she turns over. Models, so we have a little bit longer torso to work on. And I wanted to bring up the concepts of stress and how this impacts our lives and why the massage works so well in this way. The massage is done very, very slowly because we're working with the subconscious mind. And that part of our brain is housed in the thalamic area in the limbic system. It's also an area that is associated with the responses that our body has to stress. So the idea was brought up that if stress can cause so many problems in our body, then the opposite should be true if relaxation is employed. And that's exactly true. And the area of study that really focuses on that is called psychoneuroimmunology. And the whole idea is that we can think ourselves into a state of illness or dis-ease, just as we can think ourselves into a state of wellness or well-being. So it's not really the stress that bothers our bodies that much. I believe we are designed to handle stress. I believe it's more how we handle the stress that makes a big difference. So by employing the limbic system, which we have total disposal at our hands, or at our minds actually, we can get the hypothalamus and the pituitary to begin to work with us on a much more deeper cellular level as we begin to think more positive thoughts and to do more positive things. Less stress bothers us. A muscle response with stress If a muscle is not used, it atrophies. If a muscle is not used, the bones will become brittle. As in an older person, the marrow becomes yellow, so the core begins to just disintegrate, and we don't make blood cells, and all these things that are important for movement and function. So as we add resistance, which is like a stress, to the muscle, we're building the bone fiber. We're creating much more strong cords of tension in the bone and building muscle fiber. Now, muscle weighs a little more than fat, doesn't look as big though. So the more you move your body, the more you're stimulating the thalamus to do its job, which is to work with the antagonist-agonist idea of when one muscle contracts, the other one has to relax. It's also working with the idea that when you stimulate the thalamus's job is to reduce pain in the low back and to elicit portions of the limbic system, which is in the reticular fibers of our brain. And it is also my belief that that is where our subconscious mind is housed. So it's not unusual when you're relaxing for emotions to come up to be healed, tension begins to let go. You might even experience pictures of past experiences coming up, which is just fine. But you don't have to do anything about it. You just simply relax, notice it, and then breathe and let it go. So remember that the psychology of your health is real important, just as important as what you put in your body and your food and your nourishment. You want to nourish your spiritual body with positive thinking and relaxation to counterbalance the stress that you're going to go through on a normal day-to-day life. So with that in mind, we're going to finish this segment of the massage, the Wellspring Massage, and hope you join us next time.
Can be found littering the open spaces of Illinois. Much of this debris is harmful to fish and wildlife. Monofilament line can harm and kill wild animals. Other trash is unsightly to look at, and vandals deface property. If you enjoy the great outdoors, help keep the outdoors looking great and safe. You can do your part by recycling or properly discarding trash. If you fish, don't leave behind monofilament line, bait containers, or other debris. If you're on a picnic, cut apart six-pack rings and look for the new recycling sheds for glass, paper, aluminum, and plastic. Public land in Illinois is here for all of us to enjoy. Please leave the land looking as good or better than when you found it.
Hi, I'm Wanona Wellspring, and this is our next section on the Wellness Connection. Today we're going to be talking about the massage on the front of the legs. And with Wellspring Massage, we want to make sure to remember that we're going to go really slow. We're going to breathe with our client, and we're going to make our client feel as comfortable as possible. So let's begin with some gentle rocking. Our client has just turned over, and so we want to encourage another segment of relaxation. Every time you move the body, it changes its positioning. So a little bit of gentle rocking on the area that we're going to be working on. Okay, now we're just going to uncover one leg at a time while we're working. So gently uncover your leg. And as we drape, we're going to pull the sheet up underneath the opposite leg and up underneath the ribs. That way it'll stay secure. Okay. This is just a real quick way of draping. There are much more detailed ways, but this really holds the sheets in place. We're going to begin by putting the oil on. We want to warm the oil in our hands. So put a little oil in your hands, rub them together to get the warmth in, and start with real light strokes to begin to spread the oil. We're going to work all the way up into the low back, because when you work on the front of the legs are also connected to the hip area. And we want to make sure that we connect all of these body parts that work together. It's real important that your client stay relaxed and breathe. So the first stroke that we're going to do is just a long connecting stroke. It's going to connect the feet with the lower leg and the thigh and the low hip. So you'll notice that I'm moving a lot with this leg. So we come down here, we're going to slightly internally rotate by just putting a little pressure on the foot and come up over just to the front of the leg. So we're just lateral to the tibial bone and coming up the thigh, just lateral here over to the hip and into the low back. And we're going to come up underneath the glutes and underneath the thigh, a little shaking right underneath the knee. We're going to join our hands and come off the lower leg. Nice little tug. Now that's the major stroke for the lower leg. So let's do it again with a Y stroke. Gently over the knee, and when we come up here to the hip, we're going to come up into the stomach. And then come up around the leg. Okay. Now with this type of massage, we're going to do a lot of overlap. So in our first section, we worked on the back of the legs, and we included some reflexology. And now that we're working on the front of the legs, we're also going to include some reflexology on the feet. So we're going to come down here, and you're always going to work from the heel to the toe, because you're standing on your face. And as you stand on your face, you have sinus points at the top of the toes, lung in the middle, right at the joints where the joints bend. Your small intestine and your organs are in the middle of the foot, and your low back is at the heel. And all around the ankle, this low back area. So the front of the leg would be the chest. So we're going to just warm it up a little bit with a little vibration. And coming off of the heel, we're going to come up along the spine. So this is where our spine is on the foot. All the way up. And just do some lines of energy, working through those organs and all along those muscles that fan out into the toes. And be sure to include the toes because we don't want them to stay congested. Very good. Okay, now just like with the leg, when we had our person on their stomach, we're going to do some effleurage on the leg. Effleurage is a French term meaning to flow. So we're going to add some circular strokes. Divide the leg down the midline, coming around and meeting again in the midline with these circles that overlap. So we're just beginning to encourage the blood to flow back up to the heart. Back up into the low spine again. Meeting behind the knees and off the leg again. Now the front of the leg, we have the tibialis anterior and some peroneal muscles. You'd have to be very careful with this area because it's so bony. So what we're going to do is a Y stroke, and I'm going to plant my thumb just to the lateral side of the tibial and press with my other hand. So we're not using strength, we're just using body weight. And then come up off of the knee and down. So you notice that the massage strokes are a little bit deeper. The return strokes are a lighter stroke. Here we're working on the peroneals. So this would be on the fibula. Okay. Now while we've got the foot internally rotated, I'm just going to do some little presses with my thumb. I'm just resting my hand and doing presses with the thumb right on the side there. How's that feel?
It's fine.
Okay. A lot of times if your client has pain in the ball of the foot, if you work the peroneals, since they come around and attach to the base of the greater toe, this is a real good way to get rid of feet problems. And also if that muscle is real tight, it'll tend to make the foot flat. Okay. Now around the knee, we have a lot of energy that circles the knee. So we're going to do what we call a C stroke. You take opposite hands going in different directions and make a C, come back around. So we're going to really work that patellar ligament that goes on top of the knee. Okay, so let's continue with our effleurage again over the knee and get a little deeper into these quadratus muscles. Now we're going to work layer by layer. So I'm going to, in addition to the effleurage, we're going to do the crossover stroke. We did this also on the body when they were prone. So you come up just above the knee. You're going to press on the inside of the thigh as well as on the outside of the thigh, hands facing, and brace your elbow on your hip so that you can get more leverage and push with one hand and then squeeze with the other as you squeeze towards each other and just gently come up and cross over. That's why we call it the crossover stroke. So you're able to actually add presses into the muscles, and each time you do that, you're increasing lymphatic flow and nourishment into the area and further relaxing. And the slower you go, the more gentle it is and the more effective it is. So be sure and have your client breathe deep and exhale thoroughly. Get those toxins releasing. Very good. And Okay, now normally we would go towards the heart, but since we're working on the rectus femoris muscle, which attaches at the hip, right at the ASS, we're going to press down and go towards the knee. Now because the knee is bent, this muscle is already a little bit relaxed. And just relax. And we're not going to press it. We're not going to go too fast. We're just going to keep pressing down and just let our hand go as it wants to, right over the middle of the belly. And then gently come up as we begin to get closer to the knee and come off of it. That's really good. Now we're going to work on the tensor fasciae lata. Now this muscle, in order to get to it, we need to internally rotate the knee. But we never do anything with the kneecap. We never press on the kneecap. We never want to hurt that knee. So we're going to come just above it and press. And this again, you're going to anchor your elbow onto your hip and just press. And just the weight of your body is going to keep that knee where you want it, with the leg slightly internally rotated. And when you get closer to the greater trochanter, which is the big hip bone over here, you're going to lighten up, keep the knee internally rotated, come into the lower back, over the glutes again, and meet behind the knee, and coming off the leg. Little tug. That's good for those rotator muscles. Now let's say, for instance, you have somebody who does a lot of bicycling. We're going to bend at the knee and just elevate the leg just a little bit. So I've got his foot resting on the body cushion, and the inner thigh is now exposed. So we're going to add a little bit more oil, and we're going to treat this as if it was the front of the leg and do some effleurage. We're going to divide the leg in half and do our nice gentle effleurage strokes on the inner thigh. Very good. Now if this is a strain, you can also put your knee on the table and brace the person on your knee. That way they don't have to strain too much if the muscles in this area are too tight. Now what we want to do is we want to come up just above the tibial head here, just on the femur, and we're going to press with a palm. So we're getting the gracilis and the sartorius and some of those muscles that help us to rotate our thigh. Then we're going to come down below the gracilis and use a finger pressure with all fingers together, and then we can just repeat that. And again, if you go slow enough, it should be comfortable to the patient. But if they seem to be guarding, then just go real light. Give them a chance to adjust. It may take 3 or 4 sessions before they really get into it and relax. Now to get a little bit deeper, we can add some thumb over thumb. So we start right off of the bone here and do some thumb over thumb. Again, we're just above the gracilis muscle. This is an excellent area to work on for people that sit for long periods of time, especially if you've had a long car ride, because the vibration seems to really tighten up these muscles, and we're able to get into the adductors, which get really, really tired from sitting for too long. Especially young mothers, especially as you get further along into the pregnancy, those adductors don't get enough blood. And we're going to gently move the leg back, and since we've had it extended, let's rock it a little bit. Get some blood back into those rotators as they begin to relax. And now we're going to just brush off the leg, do some nice feather strokes as we conclude this portion. And as we begin to allow the body to communicate with its other half, we'll brush that side as well. So this gets the body ready for the other half of the leg massage. And as you begin, you can go ahead and start undraping this side and repeat the same routine that we did on the left leg. So I'm going to let you do that on your own. And what I want to show you now is a way of completing this side. You have energy meridians that run up the front of the body and down the back of the body. So if you finish this side of the leg, you want to connect the two sides. So you begin at the stomach and come down the sides of the legs and off of the toes, and repeat this 3 times. And this basically will run those meridians and balance them. And you can come off the feet and check for yourself. You can find little pulse points and hold them and feel for the pulse. Make sure you've got a balanced pulse on each side of the body. You can come underneath the middle of the toe flexors here. And I think we've got a nice balanced pulse for this young man. Okay. So this concludes this portion of the front of the legs. And in our next segment, we're going to be talking about the upper torso. We're going to include the stomach, the chest, the head and the neck, and some of the arms. And I hope that I see you then. Until then, have a good massage.
Remember, children, don't talk to strangers, don't get into any cars, don't talk to people who don't look like anyone you know, and don't leave your property unattended. Thank you.
We ask. What are you doing?
It's scary.
Hey, over there. What are you doing?
Do you know?
Okay, hi, I'm Reverend Wanona Wellspring, and this is the Wellness Connection, and today we're going to be doing our fourth segment on Wellspring Massage. Today we're going to be working on the chest and the upper torso. We're going to include the stomach, the chest, the neck, the head, and the arms. When we begin, we want to gently undrape the area just down to the hips. Make sure our client is comfortable, the room is comfortable, and the music is playing softly. We're going to put a little oil in our hand, warm up the oil, and begin application on the chest. And we're going to include the arms. As well as the upper shoulders. Each time we make a pass over the chest, we're spreading the oil a little bit thinner. We want a nice coating so we don't have any sticking or pulling. So let's review that. This is the master stroke. We're going to begin just on the pectoral area, coming down the middle of the chest and the stomach, around the hips and the chest, just on the side of the ribs, coming over the pecs again, down the arms, and gently back up and include the shoulders and the neck, all the way off the head. So this is our master stroke, and it can be done many times or a few. It can be done at any point to reconnect and have the patient feel very connected. And you notice that I'm using a large surface of my hand. The larger the surface area that you're using, the less deep you're going and the more comfortable it is to the person. Now we're going to work a little bit from side to side. In this position, working down the chest, we're going to come into the abdominal area, right underneath the ribs. And we're just going to do a nice hand-over-hand stroke up the side, including the pecs on that side, and then switch to the other side. Gently underneath the rib cage, and including the obliques and the muscles on the side of the chest, and then finishing off on the shoulders. Now we're going to come to one side for this arm. Just relax. We're going to go ahead and add a little bit more oil to the forearm. And this is sort of a modified Y stroke. You have a Y stroke coming down into the elbow and then another one that follows, but we're holding the hand. So it just rests in our hand. So hold the wrist, coming down to the elbow, and then over. You can treat the arm a whole lot like you do with the leg, except that it's just a smaller surface. Okay, now we're going to bring the arm up just a diagonal away from the chest. And just let this relax. There you go. Now I'm going to stretch the pectoralis muscle and begin with a press on it, and as I press, the arm is going to shrink and roll in. So this is a very nice way to work this pec muscle. If you have anybody that has a frozen shoulder, this is a great technique. And press. So we're able to work the large pectoralis major as well as the pectoralis minor. Just relax. There you go. We can come in behind the neck to include the trapezius muscles, the back of the shoulder blade, and the arm. And as we come up the back of the arm, you notice I'm doing little presses. And what I'm doing here is I'm actually working on these meridians, the heart meridian and the large intestine meridian as they come down the arm. To include the hand. Now this is a great press. You fold under your hands, your fingers go into the palm, and you spread the top of the hands. I call it making tortillas because that's how we make tortillas. And then coming off of each finger, you want to pull and twist and tug at the same time that you're balancing the wrist in your opposite hand. A little vibration to make sure that they're nice and relaxed. Now when you work deep into the forearm, you have two meridians that go into the front and one in the back. So we're going to relax the hand, relax the arm, and come in between the two bones of the forearm and just press real slowly, following those bones right up into the elbow, and relax. And here's the same thing. We're going to bring the arm up and press just along the ulna, right into those deep muscles. This is great for people that do a lot of work with their hands, as we're working on the finger extensors and flexors, and then right up here on the radius, coming up into those finger extensors. Very good. Now, this is a great time to be working on the pronator. The pronator is the muscle that helps us to pronate our hand. So that means it brings the hand down. So what we're going to do is we're going to supinate the hand as we run over that muscle to stretch it and work it. Now this is going to be really sore with people that type a lot or people that are having carpal tunnel problems. So work to the comfort of the person that you've got on your table, but work it really well. And then I like to stretch out that pec and that biceps. And that's a real good work for the arm. And then combine it all together with a nice major stroke again. And then we'll work the other arm. So again, you pre-stretch the muscle, and then as you stretch it again with your press, you allow the muscles to bring the arm down as the muscles just dance around for you. There you go. Very good. That's a nice, gentle. If you really have some problems in here, you can actually add more press in here with the elbow, but we're not going to do that. That's a little bit too deep. Another good way to use this arm is to help lengthen the latissimus. So in this direction here, we have the latissimus totally elongated. So we're going to stabilize the elbow here, and we're going to come down over the triceps and press gently, and then up over the ribs and down to the low back again, and come right back up. And now we can pull this arm and stretch. This can be felt in the low back as well as in the upper arm. And then just let this gently come back around. Now, if you've got tenderness in here, this is a real delicate area to work on with the lymphatics. And as you work it, you want to bring the arm up and relax it, and bring it up and relax it. Very much like you did with the pectoralis muscle. So let's stretch this one. So we're going to stabilize the elbow. Let this just relax. Stabilize the elbow, coming down on the side of the torso along those obliques into the lower hip, coming back up and stretch, nice shoulder stretch. And then coming back down to the side. Very good. Okay, let's go to the abdominal area. Now, I want to mention that if you have a woman that you're working on, you can do everything except the chest work. You would leave the sheet up, covering the torso. And then when you get to the stomach work, then you would simply cover the breasts with a towel or a sheet and pull the basic sheet down so that you would expose the belly. And then you can work on the belly, and then the woman would still be covered up. So we've got a little bit of oil on our stomach. I'm going to come down over the ribs, underneath, right near the kidneys, and back around. This is a nice, good stroke to warm this area up. You come up over the hips. So if the woman is draped and you weren't able to do that nice stroke at the beginning, this is a good time for us to add those oblique raking here. So let's start with just a basic stroke. This is called the half moon. So you're going to go with one hand, make a circle, and the other one you're going to follow it, and you get a nice little rhythm going. So you make a half circle with one, follow it with another half circle, all along the colon area. And you want to make sure you're going in a clockwise direction, because this is the colon area. And the colon goes ascending and transverse and then descending. So always follow that direction. Okay, now we're going to work on the deep muscles of the hip and the abdomen. So as you bring the skin around the hip, and with your other hand, your free hand, come in here to the iliacus and work just inside the hip. And all we're doing is just a few little presses to bring some energy and some blood into the iliacus muscle. And then smooth it out. Same thing with the ribs. We're going to bring some skin up here, come up underneath the ribs and press under the rib. Get that abdominal muscle to release. A few little presses. Very good. We can do the same thing to the other side. Bringing the skin up towards the middle. Press underneath the rib cage. See how much nicer this muscle is relaxing. We have polarity points up inside, underneath the ribs. That's why we're trying to get so deep in there. Same thing with the hip, coming into the iliacus. And then smoothing it out. Now, if you've got somebody that has a problem with low back pain, you might want to spend a little bit of time on the psoas, which is actually midway between the ASIS, which is the anterior superior iliac spine, and the belly button, and just divide a midline there and come down and check for tenderness, and do never go beyond the patient's comfortable range. Just go straight down and hold it and allow them to relax with you. And then smooth it out. And if it would help, they can also bend their knee. It would relax the muscle just a little bit more. can get the psoas muscle to relax, it will help the lower back to relax, because if psoas gets tight, it tends to pull the lumbars forward, and then you end up with spondylitis, and that's very uncomfortable. So we come up over the iliac crest down to the middle of the stomach as we come around and smooth all this out. And we're going to finish with a nice little wheel, the circle wheel. You're going to pretend like the belly button is your midpoint, and you're going to be taking your strokes from the outer rim of the wheel into the belly button. And especially this is really good for women to come up from the pelvis towards the belly button. It will help to strengthen the broad ligament that holds up the uterus and get rid of a lot of female problems. So it's a really good way to nourish those organs inside the abdominal area. Okay, we're going to go ahead and cover and keep our client nice and comfortable, and we're going to move to the neck, head, and shoulders area. And you might want to switch to a different oil or not use one at all. So I'm going to use a nice facial lotion that has a lot of healing qualities for the face.